But one would hope in a country as wealthy as the UK, with an established public health pattern, with long-established advice on vitamin D and calcium intake, that this would be exceptionally rare, and it's not.
Yeah, exactly. One of the things we found, sadly, and this is one of the shock findings of the surveillance, was that although there was guidance about who should be getting vitamin D supplementation, 70% of children who are eligible to take supplements were not on them. That's a failure of public health policy, and that's one of the main findings of the study.
Advice about when to give vitamin D supplements to babies and children has in the past been somewhat confusing. The latest guidance, released in 2016, is much clearer and recommends that supplementation be considered in all babies and children under 5 unless they're drinking more than half a litre of formula milk a day. But simpler guidance doesn't mean that it's going to be followed. Dr. Wolfgang Hogler is consultant endocrinologist at Birmingham Children's Hospital.
Most European countries supplement all infants universally, independent of the mode of feeding, and they're doing very well in there, but the UK is sadly lagging far behind. So of 100 infants born in England, only 5 to 20 receive supplements, whereas in the rest of Europe those numbers are over 80. And that's a policy and then policy implementation problem that is very UK specific.
What are we doing particularly wrong in the UK? Because, the latest guidance suggests essentially that every child under the age of 5, irrespective of their age, irrespective of how they're fed, the parents should consider vitamin D supplementation.
Yeah, that's true. But
seems easy advice to follow on the surface, yes?
Definitely. This is where one has to think how a prevention program works. Why is it that the prevention of infection through the immunization programs, so the vaccinations in the first months and the first year of life, works relatively well in the UK, with over 90% of infants receiving those vaccinations, and why does the other prevention program to prevent rickets not work? And the answer is because one program is supported, funded and monitored, and the other one isn't. In most European countries, you get your first bottle of vitamin D at discharge from a neonatal unit, and then you register at your GP or paediatrician, who then will again monitor the supplementation at every child health surveillance visit. And that's not happening in the UK.
Are there any examples of good practice where they've managed to make inroads?
Yeah, in Birmingham, when there was a public health campaign and the percentage of infants actually receiving supplements was increased from 5 to 20%. But, I've just given you the numbers. In most European countries, that number is above 80%. So raising awareness and talking to everybody doesn't help. What you need is somebody being made responsible. The GPs in England are responsible for the immunization program. So why does the government not make them also responsible for monitoring the vitamin D supplementation? It is a fact that 85% of all parents in the UK actually don't know that this program exists.
A member of a European Society for Paediatric Endocrinology working group, Dr. Hogler was behind a question raised at Westminster.
Asked Her Majesty's government whether they have any plans to designate a group of healthcare professionals to be accountable for the prevention of rickets. And the response by the government was, how can I say that politely, not satisfactory. They said rickets can generally be prevented by ensuring that children have a healthy, balanced diet, spend some time outside in the sun, and take appropriate supplements. That was their response, and they said they have obviously published the NICE guidance, which says everybody should be on supplement, and the local commissioners would wish to consider how best to take forward these recommendations. Right, that's all nice, but it's wrong. Government seems to ignore the UK's latitude, the fact that we don't have enough sunshine, and the sunshine is the main source of vitamin D. They ignore any public health expertise that is out there that says the messages need to be simple and that monitoring is required of such prevention programs. So I'm becoming a bit frustrated with the UK government's attitude towards this.
And we'll probably ask him to come back in another 6 months for another checkup.
Okay.
Do you have any other questions, or was there anything else you wanted to tell me?
So will his leg get completely straight if he keeps taking on the vitamin D?
I expect it will. As long as he keeps taking the vitamin D and continues with a good diet. You need to have calcium in the diet. So the calcium with the vitamin D should make his legs completely back to normal.
So it's very important for calcium and vitamin D to go hand in hand together.
Exactly, you need both.
Okay.
Dr. Benjamin Jacobs in his clinic at Stanmore. We've spoken to Public Health England, who say there are no plans for a formal monitoring programme for vitamin D supplementation. Instead, the policy is to continue to work with local authorities and health visitors to give healthy nutrition advice to all new parents during the first 2 years of life.